CNA occupied bed safety rail use. Welcome to the quiz. Question 1. While providing perineal care to an incontinent female resident, you notice a red, raised area with a small amount of white discharge in the labial folds. What is your priority action? Option A. Gently clean the area from front to back using a soft cloth and peri-wash. Dry it thoroughly and report your observation of the redness and discharge to the nurse immediately after finishing care, as this could indicate a yeast infection needing assessment. Option B. Document the finding in the resident's chart and continue with your duties, as this is a common finding. Option C. Ignore it, as discharge is a normal finding in incontinent women, and continue with the care. Option D. Clean the area thoroughly with antiseptic wipes and apply a thick layer of barrier cream to treat the possible infection. The answer is A. Proper cleaning and reporting are essential. Option A is correct because proper cleaning and reporting are essential. Option B is incorrect because documenting alone is not enough. Option C is incorrect because ignoring could miss infection. Option D is incorrect because antiseptics and barrier cream may not be appropriate. Question 2. A resident with a history of dysphagia begins to cough and has wet-sounding respirations while eating lunch. What is the most immediate and crucial first step? Option A. Instruct the resident to stop eating immediately and lean forward slightly to encourage effective coughing and clear their airway. Stay with them and observe closely. If the cough doesn't clear, call for help. Option B. Encourage the resident to take a sip of water to help wash down the food that is causing the cough. Option C. Leave the resident to go get the suction machine set up at the bedside. Option D. Slap the resident firmly on the back to dislodge the potential obstruction. The answer is A. Encouraging natural clearing and monitoring is the first step. Option A is correct because it allows natural clearing and monitoring. Option B is incorrect because water can cause aspiration. Option C is incorrect because leaving is unsafe. Option D is incorrect because back slaps are for complete obstruction. Question 3. You're assisting a 78-year-old resident with a history of CHF and dizziness to ambulate to the dining room. Halfway there, she stops, leans heavily on her walker, and says she feels very dizzy and like her heart is racing. She is pale and diaphoretic. What is your immediate priority? Option A. Ask her if she took her water pill this morning, as dizziness is a common side effect, and suggest she drink some apple juice in the dining room to boost her blood sugar before continuing. Option B. Quickly pivot her around and hurry her back to her bedroom so she can lie down, as getting her off her feet is the priority. Then go find the nurse to report what happened. Option C. Encourage her to keep walking slowly to the dining room so she doesn't miss her meal, as nutrition is important, and report the incident to the nurse after she is seated. Option D. Recognize these as potential signs of cardiac distress. Immediately instruct her not to move, gently lower her to a nearby wheelchair or to the floor against the wall to prevent a fall from fainting. Stay with her, and call out loudly for another staff member to get the nurse stat. The answer is D. Stopping the resident and preventing a fall is the priority when someone shows signs of fainting. Option A is incorrect because asking about medication and suggesting juice delays addressing the acute symptoms and does not ensure safety. Option B is incorrect because quickly turning and walking back could worsen dizziness and increase fall risk. Option C is incorrect because continuing to walk could lead to fainting and a fall. Option D is correct because it prioritizes resident safety by preventing a fall from syncope and immediately summoning help. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 4. While providing a bed bath to an 85-year-old male resident with left-sided weakness from a recent stroke, he suddenly grabs your hand, tightens his grip, and yells, "No. Stop. Don't touch me there. It's mine and you can't have it." He appears genuinely fearful. What is the most therapeutic response? Option A. Assume this is increasing confusion and aggression. Leave the room immediately to find the nurse and report that the resident is becoming combative and needs medication before you can complete the bath. Option B. Firmly explain that you are not trying to take his arm, you are only washing it to keep him clean, then proceed quickly to get the task done as personal care is a necessity. Option C. Try to use distraction by talking loudly about the weather, and while he is distracted, gently and quickly wash his left arm. If he resists again, use a soft tone to reassure him it's okay. Option D. Immediately stop, remove your hand, and step back to give him space. Using a calm, soothing tone, say, "Okay, I'll stop. I'm sorry I scared you. My name is your name, and I'm here to help you with your bath. You seem very worried. Would you like me to wash a different part first, or would you like to take a short break?" The answer is D. Validating fear and offering choices is the most therapeutic approach for a resident who appears frightened. Option A is incorrect because assuming aggression and seeking medication is premature and ignores the possibility of a fear-based reaction. Option B is incorrect because forcing care despite his resistance can increase fear and lead to aggression. Option C is incorrect because distraction disrespects his feelings and may be perceived as manipulative. Option D is correct because it de-escalates the situation by validating the resident's fear, giving him control, and offering choices. Question 5. A 92-year-old female resident with advanced Alzheimer's disease is sitting in the common area, rocking back and forth in her chair and moaning softly with a grimacing expression. She ate about 50% of her meals today. Her care plan notes a history of constipation and osteoarthritis. What is the most comprehensive initial assessment for you to perform? Option A. Approach her calmly, crouch to her eye level, and speak gently. First, check her brief for incontinence. Next, gently palpate her lower abdomen for distension, indicating a full bladder. Then, ask a simple question like, "Are you hurting somewhere?" while observing her reaction. Note your findings to report in detail to the nurse. Option B. The rocking and moaning are likely self-stimulating behaviors common in late-stage dementia. Sit quietly beside her and gently rock with her to create a connection, then document the behavior in the chart. Option C. Since she is moaning, she is likely in pain from her arthritis. Go to the medication room and administer the PRN acetaminophen ordered for her to provide immediate relief. Option D. Immediately take her to the bathroom, as rocking and moaning are classic signs of needing to void in nonverbal dementia patients. Place her on the toilet and use the call light to request assistance to stay with her. The answer is A. A systematic assessment helps identify the cause of distress before intervening. Option A is correct because it provides a systematic assessment to identify possible causes, pain, bladder distension, incontinence, before intervening. Option B is incorrect because dismissing the behavior as self-stimulatory may miss underlying issues like pain or discomfort. Option C is incorrect because medicating without assessment could mask symptoms or be unnecessary. Option D is incorrect because assuming a need to toilet may be incorrect and could cause distress if she doesn't need to go. Question 6. A 67-year-old male resident, post-operative day 1 from total right knee replacement, is on fall precautions and anticoagulants. You enter his room to find him attempting to get out of bed alone to go to the bathroom, stating he didn't want to bother anyone. What is your priority action and subsequent plan? Option A. Tell him to wait right there while you run to get a second person to help you, leaving him sitting on the edge of the bed alone while you find another CNA. Option B. Quickly rush to his side and firmly push his legs back onto the bed, scolding him for attempting to get up alone after surgery. Remind him of fall precautions, reposition him, and hand him the urinal. Option C. Calmly but quickly move to his side and place yourself in front of him to prevent him from standing. Thank him for telling you he needs help. Assess his pain level and ask if he feels dizzy. Explain you will help him safely get to the bathroom with his walker and non-slip footwear, and possibly get a second person to manage tubing and support his surgical leg. Option D. Assist him to stand up since he is already halfway there. Tell him to put all his weight on you and his good leg, and quickly walk him to the bathroom to meet his need efficiently and prevent him from trying again alone. The answer is C. Ensuring safety while addressing the resident's need is the priority. Option A is incorrect because leaving him alone on the edge of the bed is unsafe. He could fall while you are gone. Option B is incorrect because scolding and forcing him to use a urinal may not address his urgency and could cause distress. Option C is correct because it ensures safety by preventing an unassisted fall, assesses his condition, and plans a safe transfer. Option D is incorrect because assisting him to stand without proper support and assessment risks a fall or injury to his surgical leg. Great job! Don't forget to subscribe. Bye!